Okay, before entering the patient's room, I have gathered all my supplies and checked the medical record for what the doctor has asked that we do for this patient. So he has asked that the patient gets his wounds checked and changed every 6 hours, and right now is the time for us to do that. So again, I've gathered all my supplies and I will come into the patient's room. Hi, Mr. Jones. My name is McKady and I'm going to be your nurse today. I will do hand hygiene and I will pull the curtains to make sure our patient has all the privacy that they need. So, Mr. Jones, I'm going to check your identification. Can you give me your name and birthday? Perfect. So, Mr. Jones, we are going to assess your wound real quick, see if it is healing, if there is any infection that's developing. We're going to check it to make sure everything is going according to plan. Do you have any questions? Okay, perfect. We know that you've had this done before. And we gave you oral medication for your pain 30 minutes ago to help alleviate the pain. Has that helped your pain? It's decreased? Perfect. That is so good to hear. So again, I've moved my table close to the patient so that I don't have to turn my back on my sterile field when I set it up. And I have moved the trash can right by the patient's bed so I can do all that. Okay, Mr. Jones, I'm going to lift your bed so it is a comfortable work position for me. And are you comfortable, Mr. Jones? Perfect, that's good to hear. So we are going to expose the wound, trying to cover up the patient as much as we can so that we only have the wound to give them their privacy. And I'm going to put on some clean gloves while we do this with the patient. So now we have shown the bandage and we are going to assess it, make sure, you're going to assess if there are any tubes coming out, and if there are tubes, we need to be aware of it when we're taking off the bandage and applying it and cleaning it and everything. We need to check if there's rash around it, any irritation or anything, but upon inspecting the wound, it looks good, so now we're going to remove it. You're going to use a push-pull method, and we're going to go in line with the grains of the hair to make sure that it does not cause any damage to our patient. And if there's any spots that get stuck on the patient's skin, we can apply some sterile saline to have it come off easier so we don't cause any more skin damage than we need to. So we're going to pull off very lightly, and we are going to first inspect the wound. So upon inspection, we are looking if there's any foul smelling odors, how much drainage there is, the color, and anything that would be inspected with the wound. And then we are going to chart that and make sure that it gets documented for the next people. And we will throw that away. And while we are here looking at the wound, we are going to inspect the draining in tubes. If there are any of them, we're going to look for any staples, any stitches. We're going to inspect the skin, just see how it is, so that again we can document it. And while we are inspecting the skin, we are going to measure the wound. So we're going to open up a package, and this right here is a sterile measurement. So you can pull it out, and we are going to measure a few different things. We're going to measure the depth and document it. And we're also going to measure the length of the wound and the width of the wound. And again, those things will be documented in the patient's chart. And once we have done that, we are going to remove our gloves and throw them away. So now we are going to do hand hygiene and then set up our sterile field so that we can clean the wound and redress the wound. So again, we're going to make sure our patient is comfortable, that they aren't having pain. If they're having pain, trying to help them with whatever they need. So we're going to begin by opening our wound care kit, taking just the top off and making sure not to touch anything within it, keeping that all sterile. And we will open our gloves. So we're going to start, we're going to step away and we're going to pick up the glove for our dominant hand and insert our hand while only touching the inside part of the glove to make sure that the outside part stays sterile. Then I'm going to put my sterile glove under the cup of the other and lift it up for my other hand to be placed inside. Then I will pull down the cuffs, making sure to only touch the outside sterile part with our sterile glove. Now we're going to remove that paper, and we'll throw that away later. So now we are going to pick up, here's some other sterile gloves for later. We can set those off to the side because the outside packaging is fine for us to touch later while still keeping our gloves sterile. So we'll lift up our sterile field and open it, and we can place that down. And the outer 1 inch of this sterile field is contaminated, so we need to make sure that we don't touch anything to that outer inch. And then we can begin by taking out everything within our wound kit and laying it out. So here we have a bag, and this bag is what we will put all of the things that come in contact with bodily fluid in. So open that, and I'm going to place it right here so that it is close by the patient. Again, I have another measurement tool in here that I could use. We have, just gonna pull everything out, making sure not to touch anything. Okay, so again, we've assessed the patient, made sure everything is okay, and now we are going to proceed with cleaning. So here I have my saline. I'm going to open it. Place the cap up. So because this is a freshly opened bottle, we don't have to drip any of it off or clean it before. We can just go ahead, and I'm going to pour some of this into this packaging that is sterile on the inside. So I'm going to take one gauze square, dip it in the saline. I'm going to do one swipe down the side of the patient, and then with one swipe we throw it away in the bin. Being careful not to touch the patient with our gloves to keep them sterile. Again, another swipe. And take another one. Rinse clean down the middle. I'm going to get a dry one to dry off this side and dry off the other side. So now that these gloves are contaminated, I'm going to take them off. I'm going to again apply hand hygiene. So So again, this other pair of sterile gloves that I have here, I'm going to take them out. And normally I would do this on another table or make sure I have room on my table. But we are going to apply another set of sterile gloves to now redress the wound. So again, make sure nothing touches the packaging. I'm going to lift up the one glove and insert my right hand. So I'm going to just leave it like that, and I'll come back when I have my other sterile glove on. So again, we're going to go under the cuff of this other glove. I'm going to insert my left hand. And then with them both on, I can move my fingers where they need to go, being careful not to touch the bottom of my gloves. I think I'm on my hand, keeping them sterile. So now I have that. I'm going to follow the doctor's order for how he would like the wound now covered. So again, when I'm cleaning it, if there are any drains or tubing, then you will be sure to clean around those and make sure that they are clean and intact and that there's no problems with them according to the doctor's orders. If there's any ointments or just anything at the doctor's order, we will put those in. So I'm going to place one square in there, and then I'm going to get the actual bandage and I will place that over it. And now that the wound is covered, we can stop with our sterilization because it is covered with sterile things. So now I'm going to, again, take off these gloves because they don't fit right. Throw them away, and I'm just going to put on new clean gloves after doing hand hygiene. So now for our patient, I'm simply going to just re-secure that by using tape. I'm going to make sure that the wound is either according to the packaging on the wound or it needs to be covering at least 1 inch past the wound so that it is completely covering the wound. Again, when applying a new dressing, be careful around drains, tubing, stitching, staples. Making sure that those aren't irritated, making sure that the skin isn't irritated. So there we have applied tape on both sides and it looks good and secure. And I would document on the bandage. This is an IV site thing, but we would just document on the thing the time that it was done, the date, and the nurse that did it. So I would sign it, initial it, date it, and give the time so that the next nurses know when it was done. And we will then reapply the brief. And we can clean up our sterile fill now that we are done. We will put it in the red bag. And I will take this other bag because we put the old dressing in it. You'll put this in the red bag to signify that it has been covered in bodily fluids. And again, these gloves are still clean, so I can keep them on because I didn't touch any bodily fluids. So I'm going to make sure that this red bag gets disposed of properly where it needs to go. And I will take off these gloves and put them in a different trash can. And hand hygiene. Make sure our patient is good. Now, Mr. Jones, do you have any pain with that? Well, that's so good to hear. Okay, I'm gonna lower your bed back into a comfortable position, making sure you're safe. The guardrails are up. Now, here is your call light. Call us if you have any pain. If you need anything from us, we'll make sure we get that to you. And again, make sure we document everything that it is done correctly. And that is it.